Land, how are you? Thanks for tuning in with us today with Helping Hands TV. We're having the second interview with Miss Sheila Benjamin, the owner of Helping Hands Visiting Angels, and we just came today to ask her just a few questions. How are you doing today?
I'm doing great. How are you?
Wonderful, doing wonderful. Thanks for asking. Can you tell us a little bit more about Helping Hands Visiting Angels? Kind of like the you told us before exactly what you all do, but can you also maybe can expound upon exactly the company again itself?
Okay, we are a company dedicated to helping people.
Hmm.
We come with a new concept. We do a concept called team nursing, to
Okay.
where we actually come into your home and provide home health care,
Hmm.
but we do it in a different way. With the doctor's part of the team, the
Hmm.
family's part of the team,
Hmm.
and the client is part of the team, and
Hmm.
our staff that actually comes into the home is part of the team.
Hmm.
So the family gets to have input
Okay.
into their care.
Okay.
They get to give us feedback of what's working for them, what's not working for them. So it makes all of us become one big team that
Hmm.
makes sure that the client gets the care that they deserve.
Okay. Doing my research, because I did a little research before you came in today, there was something that you had on your website that was called interactive care. Is that what you're speaking of? Interactive care?
Yes,
Okay.
interactive care
Hmm.
and team nursing is the same concept.
Okay. Okay.
Interactive means that you have an interaction that you get to be a part of
Okay.
your loved one's health care.
Okay.
So you're in the decision making process
Okay.
from the beginning to the end, and everything is tailored to
Hmm.
that particular client.
Hmm.
We sometimes things just don't work out, or sometimes personalities just don't match.
Okay.
So
Okay.
you wouldn't be required to keep that person.
Hmm.
We would keep working at it until we got the right fit for the client and the client's
Okay.
family, because the family is a big part of the client. If you have the right person in your home,
Hmm.
then the whole family is going to operate better.
Okay.
They'll feel good about talking to that person about what their
Hmm.
loved one actually needs versus somebody that you really don't care for and you really don't
Okay.
want to talk to them, period, let
Okay.
alone talk to them about your loved one.
Okay, so I think what you're saying is that you're looking for more than someone just working, but someone that has a passion for what they do. How do you decide, or who decides what caregivers goes into the home? Does the client decide that, or is the company, or how does that work?
It's a combination.
Hmm.
The company will call the client. We will tell them what we have available,
Hmm.
tell them their likes. But first of all,
Hmm.
we have the clients to do a profile sheet. And it
Okay.
tells us a little about their likes, their dislikes,
Okay.
what they're looking for. It lets us know a little about their personality.
Okay.
And then once we have that done, then we would not put somebody in that home
Hmm.
that was completely the opposite of what the actual client was, because
Okay.
what we try to do is try to match personalities.
Oh, okay.
And, of
Okay.
course, all of our people, we've done background checks on them, we've checked them out,
Hmm.
we've made sure that their license is current. So
Okay.
we've done a lot of research on the staff that we actually have.
Okay.
But we take that staff and we match, both parties fills out a profile. So
Okay.
we have a profile on our staff.
Hmm.
We have a profile on our potential client,
Okay.
and we pretty much match up profiles.
Okay. All right. All right. You probably do check out maybe the references, how the people did at their last employment. Is that something that you do also to make sure that you can match them up together?
Yes, we definitely check out the references, and
Okay.
again, we do an extensive background check.
Okay.
So we
Okay.
do run a background check on them,
Hmm.
and it's very extensive. We call references,
Okay.
we check references. If they left a company, we want to know, would you rehire them? We want to know,
Hmm.
as legally possible as they can let us know. We want to know, is it there anything that you could tell us to help us make a decision whether they're right for this company or not. But we personally interview these people and we talk about our passion, because our passion is to treat everybody like family.
Okay.
So if you cannot do that, or if you can't come on board with the same passion, the same morals, the same values, the same work ethic, then we just simply tell you that you probably would not be a good fit.
Okay.
We talk to the clients on a regular basis.
Right.
We talk to the clients 2 times a week.
Okay.
We try at least 2 times a week. Some weeks it might just be one, but we try to talk to the clients on a regular basis. We want to know how's things working out.
Okay.
We want to make them feel secure in that we care about what's going on. If something's going on that you're unhappy with, you can let us know at any given time and we will correct the problem. So, communication is the key. We really communicate with not only the client, but the family as well, so we can stay on top of exactly what's going on.
Okay. Well, let me ask you another question, Sheila. If I'm a family member and I have a loved one that is sick, and in most cases, if I'm taking care of my spouse, a lot of the times that I will have to quit my job to take care of my loved one in the home, and don't mind doing that because you love them. But is there any type of way that, as a family member, that if I'm qualified, that I could take care of my loved one in the home as well? I could, if I'm a registered nurse or qualified CNA or HHA, how can I connect? Can we actually work in the home?
Okay, the answer to that question is yes. This particular program is a workman's comp program, and it does allow family members to work for the family.
Okay.
However, the family members we only hire RNs, licensed practical nurses, or you might have heard them called a vocational nurse,
Okay.
and certified nursing assistants.
Okay.
We only hire those 3 because we track them. We track for felonies. We do background checks. We have to be able to make sure that they're not in the abuse registry. So there's a lot of things going on behind the scene to where we're making sure that these families are safe in their home. Now, if they are a registered nurse, a vocational nurse, a licensed practical nurse, or a CNA, they're already certified. We're going to check their credentials. We're going to make sure that there's not anything against them on the record or anything. We're going to check to make sure that they're actually eligible to go into the home and work. Once they pass all of that, we have a series of tests that they had to take for us that says that they meet our standards, our agency standards, because we're not going to just put anybody in the home. So once they pass all of that, they can come to work for us, and we can actually send them into the home to work for their loved one.
Okay.
If everything falls in place, everything checks out, we certainly say someone's daughter is a nurse.
Okay.
We could pay her 40 hours a week or whatever. All of this is based on authorization. So whatever the client was actually authorized for, we would actually give a shift. And again, because we do team nursing, we put a whole team in there. So you don't have as many call-ins that way. They can switch out among themselves, and we can make sure that the client is always covered. But in answer to your question, yes, family members can work for their loved ones.
Wow, that's amazing. So I would feel like that would be an advantage. Do you feel like it's an advantage for me, say that my wife is sick, I'm taking care of her? Would that be an advantage for my loved one?
Yes, it's a win-win situation because it's like you said earlier, sometimes, people have to quit their job
Okay.
and to take care of their loved one. Well, that puts them in a financial bind.
Hmm.
And this way you get to take care of your loved one, but you get paid for taking care of your loved one.
Wow.
So you get to spend that quality time with them. You get to take care of them. You
Mhm.
get to furnish, But on top of that, you're working within your job skill,
Okay.
something that you've already been trained for, you already are licensed for, or you already are certified to do. So because of that, it's a win-win situation. They don't have to meet somebody new,
Hmm.
because they're already familiar with the family member.
Okay.
And it's strictly up to the client and their family. Like I said, it's physician driven, but it's up to them because, they can say, we have family members that can do this. Can you train them? Or they're already, and then they just have to go through our agency specific training.
Okay.
We can do, if say they need 4 nurses and they have one family member that's a nurse, well, that family member would go through our agency training, and then we would put 3 other nurses with them to complete the team.
Okay. Well, that sounds good. That sounds good. Let me ask you a couple of more questions, Sheila. Why El Paso, Texas? Why did you choose El Paso, Texas?
Well, we chose El Paso, Texas because we do a lot of research,
Okay.
and we want to go where we are needed the most at.
Okay.
We kind of, as I said in the earlier version, my father was one of these workers that was injured on the job, and at the time this program wasn't around.
Okay.
So I was unable to help him
Hmm.
the way I'm able to help other people now.
Okay.
So it's a drive and passion for us
Hmm.
because we actually get to go, we get to choose. We're fortunate enough to get to choose, okay, we can go where we're needed,
Hmm.
where not that many people knows about the program,
Hmm.
where we can educate and empower people
Hmm.
that they can get the benefits, the things that they need, the assistance that they need. So we chose El Paso, Texas because there's a big need
Okay.
for knowledge of this program here.
Hmm.
And we feel like that there's a lot of people in El Paso, Texas that we could actually be of assistance, that we could actually help. We truly are God's hands of compassion.
Okay.
We serve God by serving others, by serving our fellow man. So that's what we're really all about. We're about serving, but we enjoy it.
Okay. Okay. Well, I'm sure El Paso, Texas, welcome your company to come in because you're also benefiting the family, but also you hiring people to go to work. Okay.
Yes,
And
yes.
so the economy, when you can go to work and the economy grows, and so certainly they love to have you guys in El Paso, Texas. I went to the website and I saw something that kind of caught my attention on the website. You're also part of a ministry, and that probably set you apart from other companies, I would think. That you have a prayer line and you have a minister on staff with you guys also.
Yes, we have several ministers that's on staff with us.
Hmm.
So when you get us, you also get a 24/7 prayer warrior team
Hmm.
because we send it out to our prayer warriors. So you have someone continuously praying for you.
Hmm.
You can request a minister to come by at any time.
Okay.
We're non-denominational. We do not force anything on anybody,
Okay.
but the services is available for whoever chooses to use them.
Okay.
Sometimes, you just need somebody to talk to.
Okay.
So we're not just going after the physical healing, and we're not just looking at the physical side of it.
Hmm.
We're also looking at their spiritual well-being as well.
Okay.
So whatever they need, whether it's them
Hmm.
or whether it's actually the family.
Hmm.
In the other states that we're in, we do workshops. We bring revivals to town.
Okay.
We do education workshops. We do empowering workshops.
Okay.
And we plan to do a lot of the same things in Texas.
Okay.
We seek out the need,
Hmm.
and then we see how we can meet that need. So you're absolutely correct. We're kind of like we're more than a ministry, and
Mhm.
we're more than a home health care agency.
Okay.
We're combined. We're all of that combined to
Mhm.
where we feel like we are servicing the whole person. And you
Okay.
know, and for us,
Mhm.
these people aren't just a number; they're like family. You know, my goal is to make sure that every last one of them is treated just like I would want my father treated.
Okay.
You know, unfortunately, I lost my father and my mother,
Mhm.
and you know, so I'm always looking to see, you know, okay, how would I want my
Mhm.
father or mother treated if this was the same situation?
Okay.
You know, would I want these services available to them? Would I be finding other ways to help them? And
Mhm.
you know, that's the approach of this company.
Okay. So what I hear you really saying is that you're small enough to know them by their name, but large enough to take care of their needs. Is that something?
Absolutely.
Okay. Okay. Well, that
Absolutely.
makes sense. Well, I think that's the whole question that I have for you. And what? No, I have one more question. Okay. You're the owner of the company, but are you in the medical field yourself, or you?
I certainly am. I
Okay.
am a nurse
Okay.
and I am a minister
Okay.
and I own the company.
Okay. All right. What a good combination. Very good combination. Well, thank you for joining us and Helping Hands TV. Stay tuned for our next TV series coming up in a couple of weeks. Thank you.